Welcome to Sex Care is Self-Care, a conversation on women's sexual health brought to you by the She Plus Foundation. I'm your host, Patty Brisben. I am so excited for today's guest, and that is Dr. Jocelyn Fitzgerald. And I'm thankful for our medical advisory board who has introduced myself and our audience to people that are amazing like yourself. Dr. Fitzgerald, for those that are listening here today that have never met you, know nothing about you, tell them what you do on a daily basis.
Well, thank you so much, Patty, for having me. I feel like what do they say? Like a longtime listener, first time caller of your foundation. I'm a huge fan.
Thank you.
Uh, yes, you do amazing work. Sherelle Glacia introduced me to your work when I was a fellow at MedStar Georgetown, and since then I've graduated from that program and became faculty in urogynecology at the University of Pittsburgh in 2020. And so on a day-to-day basis, I care for women with pelvic floor disorders and other complex gynecologic issues that require surgery and not surgery, a lot of bladder things, but also a lot of sexual function. So I'm very excited to be here.
And I'm going to tell you what, I know that you have to be an amazing doctor because if you studied under Sherelle,
Yes.
oh my gosh, she just brings the passion out in people. She really does.
She does. It's really like a feedback loop. Like she surrounds herself with passionate people and she mirrors, your energy back at you and then sets you up for success, sets you on your own little boat. So she's the best.
I love her. I know that a lot of your followers know you by certain terms. Can you let our audience know what terms these are and what they mean, like gyneconomics?
Yes,
I'm probably
actually.
saying it wrong.
Got my hat right here. I got it ready.
All right.
GYN Economics. It's like gynecology mixed with the word economics. And I think we all know probably what those two words mean separately, but I feel like I was constantly looking for the reasons that women's health isn't where it should be relative to the demand for its services and the skill of its practitioners. And where there's high skill and high demand, but also, low supply, there should be a booming business, a booming infrastructure, people clamoring to invest. And I couldn't figure out why that was until I dug a little deeper into a lot of, frankly, the policy and governmental structures that pay for our healthcare. And so I finally just said, I'm going to make up a word to describe this. And that's sort of what it came to be, and it stuck. But in addition to figuring out, why isn't this trillion-dollar investment opportunity in women's health, recruiting, venture capitalists right and left, it
Yes.
also has a lot to do with how the return on investment you get out of individual women when you invest in their health and you restore their pelvic floor function, for example. So it's all about the way women's bodies are a business or not a business, depending on how you look at it.
Well, before I move on to my next question, I would think that it would be a booming business because a lot of women are owning and operating and running companies, and we have the money and we deserve to have great doctors such as yourself. I know that we've spoken on our podcast about operating time, and I know this is really a passion of yours. Can you tell me and tell our audience why this discussion is so important for today?
I mean, it's so important because so much of what you just said, that you'd think women's health would be a booming business. The demand for pelvic floor reconstructive surgery is off the charts. The waiting lists are so long. Fibroids, endometriosis, so many things in women's healthcare that the demand is huge, but the reimbursement is low.
Mm-hmm.
So what we're trying to do is to recruit the best and the brightest research, clinical, people in business, people who are entrepreneurial like yourself. But when they get into the business and are putting all this effort forth and realizing that their efforts and their skill set are not being rewarded monetarily, and that shows in the way the system values them, it can be really difficult. So in a surgical setting, and I almost wish Dr. Glacia was here, gonna throw her name out there as a perfect example. She's a phenomenal businesswoman, and where I trained in DC, the surgery center that she was on the board of really helped set up. In the years after COVID, they discontinued gynecologic surgery because the time spent doing gynecologic surgery didn't reimburse nearly as much money as doing plastic surgery, orthopedic surgery, urology even. And they simply said, like, the hours you spend in this operating room aren't being as financially fruitful as putting a different surgeon in the room, even though they were doing something equally as complex and equally as needed, equal training. I mean, so many things about it, but they just, the game is rigged. The reimbursement is rigged. And so that's why the operating room time game is a very unfair one.
Okay, so when we talk about the time in the operating room for women's health, what kinds of procedures are most affected?
So I think the most obvious example of this is endometriosis surgery. So endometriosis surgery has come a very, very long way in the last few decades in terms of the technical skill, the minimally invasive nature of it, the completeness of the excision, the skill of the surgeons, as there's been a rise in fellowship trained endometriosis surgeons. But the reimbursement for that procedure is coded with only one code that hasn't been updated in almost 30 years. And so you could have anything from a very straightforward endometriosis surgery for very minimal disease, or an extremely horrible case of a woman whose organs are tangled together that takes hours and hours of meticulous dissection to free, and it bills the same amount of money. So you lose money, operating rooms do, in offering that service.
So, okay, so a 4-hour endometriosis surgery could make less money than a 30-minute orthopedic surgery. Is that correct?
That's correct. Yes. Like a even a fairly minor orthopedic surgery, like a shoulder scope or a knee scope, will garner more revenue for a healthcare system than a 4-hour endometriosis case will. So you could imagine why they want to pack their OR time with knees and hips and shoulders instead of uteruses and prolapse and incontinence and endometriosis, because it's just not as efficient and not as profitable.
Hmm.
Yeah, it's not
That is, does this fall under what relative value is and how
Yes.
doctors are impacted?
Yes, very much so. So, and the way that hospital systems get paid is very complex because there's a lot of different insurance companies. But at its most sort of basic level, the way that we decide how much different procedures are worth relative to each other, we use these units in medicine, literally called relative value units, and they are decided by the Centers for Medicaid and Medicare Services. And then most insurers copy that system. And so there's a committee, it's called the RUC committee or the RVU committee, made up of one representative from each specialty in medicine, more or less. OB-GYN only has one representative that mostly is representing obstetricians and not gynecologists or gynecologic surgeons. And they have a finite number of RVUs to deal with every year. They have a budget ceiling, and everything has to come out to net zero. So basically, they sit and fight among themselves. And if you want endometriosis surgery to be worth more money, you have to take it away from something else. And so, as you could imagine, they become very heated, and the orthopedic lobby does not want to take away any of their relative value.
Well, I have a granddaughter who turns 22 today, who has suffered with endometriosis. So this angers me because if and when she needs surgery down the road, and it's going to be make it or break it, I'm not happy. So how do we change this? Are there any laws out there that are addressing this? Do we write Congress? What kind of groups do we join? How can we support this change, because there needs to be a change, because, you know, women are birthing babies. I mean, our bodies go through so much compared to, and I don't want to play the he said, she said, or the male, female, but gamut, but our bodies go through a lot.
I'll play it. I mean,
Yeah,
people
good.
think I'm controversial in saying it, but I mean, I do think that from a purely economic workforce like standpoint, women's bodies are worth more money than men's. Like
Yeah.
I'm sorry to say that, but
Yeah.
they are. They perform a more important function. They do like build the population in the future. And so we should be investing. There are some really awesome organizations that I'm a part of. We're building some coalitions around this. We have a lot of Congress people involved on both sides of the aisle that have daughters and family members who have been affected by things like endometriosis, and they can't get access to a surgeon that has OR time. The waits are 6 months or more. It delays their diagnosis. The average time to diagnosis for endometriosis in this country is 7 years.
I know.
So imagine having like a painful period one day and you don't get an answer for 7 years. You suffer for 7 years. It's just insane. So yeah, we do have some groups. We have a lot of lawyers, healthcare policy people who are very interested. So anyone who wants to share their story, please feel free to reach out to me. We have some research going on, some policy pieces that are going on. We've talked to CMS. There's a lot of angles we're working at. We had a congressional hearing on the topic a couple of months ago this summer. That was very successful. So we'll see.
Good. I'm glad to hear that. So I would imagine if you're just starting into school to become a physician, a doctor, I know everybody looks at things like money. How much money can I make? So does this determine how a lot of young medical students, what areas that they go into because they want to make money? Or do you find your passion when you're there? I look at you and I hear you and I feel like you found your passion because you found somebody who led you down that pike. Is that how that happens? Or is just some people just, blinders on and I'm going to become an orthopedic surgeon because I'm going to make more money doing that?
Yeah, there are people, unfortunately, who do think that way. They are interested in medicine but the patient sitting across from them maybe isn't as important as the fact that they really enjoy doing procedures, for example, and they're thinking like, okay, well, what if I'm going to go to school for 16 years? I may as well come out of those 16 years making as much money as I can. Med school is very expensive.
Right.
People have loans to pay back. Honestly, the cost of medical school relative to a primary care doctor's salary these days it doesn't add up. It's pretty hard to pay back. So definitely medical students and medical schools are seeing huge demand for the high paying procedural specialties like plastic surgery and orthopedics and urology. I think it's very interesting that urology is always in the top 5 highest paid specialties when gynecologic surgery is its equal in every way. And we are the lowest paid surgeons. OBGYNs and GYN surgeons are the lowest paid surgeons in medicine. And a paper that I did recently, which has gotten a lot of attention online and has been done, I wasn't the first person to think of this over the past 10 years, but we looked at 100 procedures, 50 male, 50 female, and they were equivalent in terms of the pain and difficulty for the patient, the anatomic, intricacy, the amount of money it costs to do the procedure, the skill it takes. We made them really equal, male versus female, like a vaginal biopsy versus a penile biopsy. And the male procedures pay 150% more a lot of the time. And so you can see how urologists would quickly become like a top 5 reimbursing specialty, and gynecologic surgery is not. So, I mean, I will say this, that as usual, women are picking up the slack for other women. OB-GYN is still one of the top 5 most competitive specialties, even though people know it's not one of the top 5 highest paid, because I think women are always going to give for other women. And I think that's what we're seeing in the trends. But it definitely deters, I think, a group of talented young researchers and doctors from going into women's health.
Yeah, I can see where that happens. And
Ah,
look, I know I love Instagram, and I know
mm,
why I love it.
me too.
Um, I think your reels are amazing, so
Oh, thank
great, so good. What impact do you think that Instagram has and social media has on the medical community today?
Oh, it has a huge impact,
Yeah.
particularly for things that are in the shadows and are buried by the hierarchy that has traditionally existed in medicine. It has taken away the gatekeepers. It's allowed people to talk about insurance and women's health and
Hmm.
things that maybe are a little bit more controversial, or that you join committees and you do like your best faith effort to change from the inside, which I think is how a lot of us who are rule followers have been taught to go about things. Join the committee, work hard, go about it the quote right way. When you're in charge of the organization, you can make it a priority and you can change things. And I have a lot of mentors in the generations ahead of me who did exactly that. And nothing has changed. Nothing has changed in the 20, 25 years they've been working on this very problem. And they've gotten to the point where they said, okay, I did it the old boys way. And guess what? They said no. And so now we need a court of public opinion. And if more women know that the game is rigged against them, that's how you get the attention of Congress people, investors, women with some real capital to throw behind this, whether that be a platform or actual money or actual
Yeah.
political power. And I think Instagram is a huge piece of that.
Um, I think Instagram plays. I love, when people ask me who are some of the doctors that I should follow. Where are you getting all this information? And I love turning them on to like Dr. Rachel Rubin,
Oh,
Dr.
phenomenal.
Kelly Copperson. There's so many of you out there that they can find great advice and great doctors.
I
So
agree.
thank you for, you know, keeping that up and going, because I think the more we educate the public, that's where change is going to start taking place.
I agree. And that is, we've seen that. We've seen that. People who didn't have a voice before have one now, and change has been made
Yeah,
as a result.
yeah. I think that's so important to have a voice, to have a say, and to be educated about who's out there and who's running what. And so, for medical students and our listeners who are passionate about this issue, what kind of advice would you have for them? And how is it that they get involved?
Well, as I said earlier, I'm very inspired by the fact that despite the many, roadblocks that get put in front of people who are interested in women's health, reimbursement, reproductive rights. I mean, women's health takes a political beating more than any other field of medicine, who just kind of, yeah, deals with insurance companies and maybe pediatricians fights for vaccines and things, but nothing is like women's health. And it has not deterred the popularity of the need. So I'm very heartened by that. And I would tell anyone going into women's health to keep that mentality and to continue to use your voice, use it inside of your medical school. Talk about how, speak up when you're in your lectures and you're like, I'm sorry, we didn't really talk about female sexual dysfunction in this lecture at all, but we talked about like the mechanism of erectile dysfunction medication, or we didn't talk about endometriosis. And these are things I'm seeing come through my Instagram feed, but they're not showing up in my classroom. Like, you can write to your clerkship director, say like, oh, perimenopause starts at 35. Like, I'm not that far from that. Like, I'd really like to include this in our women's health block. you do have so much power. Medical students don't realize how much power they have to influence their curriculum. You'd be shocked. Like, we are at their beck and call, and if they want something, it's our job to deliver it. So
I
don't
love
be
that.
yeah.
That is great advice, because I know there's been research done that's not been added to the curriculums in some of
Correct.
these schools. And that, shame on them, for being, to me, that's lazy. And
I
that's
agree.
not, that's not creating great doctors. That's just creating the same old,
It
same
is.
old.
Same old,
So,
same old. And it sends a real message about what is important. I can't tell you how much I learned about medical school. I'm not saying some of it wasn't important, but the fact that we never talked about how, estrogen and progesterone affect
yeah.
the cardiovascular system, or affect the brain in the neurology section, or affect the gut. Like, we never talked about that. So as a result, nobody thought that women's health was their problem unless you went into OBGYN. And that's just not how it works. So I would encourage people to raise their hand and message these people writing the books, because they rely on your feedback.
Yeah. Well, there would probably be less UTIs in the nursing homes if people if
Right.
doctors were listening and were on
Yes.
top of the game and
Right.
changing things that are happening there. So I am grateful and thankful for all that you do. So thank you. I always have one last question. And what did I miss? What question did I not ask? Is there something else that you want to say to the audience that's listening?
I mean, part of what I think is so important about women's health is the return on investment that you get. I mean, it really is not charity work to r- give women the physical tools to live their best life. Women are the most productive members of society. They work, they raise our families, they solve problems, and the things that keep them from doing that from their 30s on, often after they're postpartum. And I always say you're postpartum your whole life after you've had a baby, is to treat things like incontinence and prolapse and recurrent UTIs, like to talk about those things. They are very treatable, and they give women their power back, and whether that be financial, time, confidence, social life. Those are the things that prevent you from having dementia and becoming frail, like, or becoming reclusive in your house. I mean, there's real economic value in dealing with these problems and not being ashamed of them, and meeting them head on. So I would encourage anyone who is interested in giving women their power back to go into women's health, because the impact is immediate.
And I think I hopefully we'll see this change, because I think it's so important. I don't think any 18-year-old girl should have to see 7 to 14 doctors before they get a diagnosis,
Yeah.
and have to cry when they do have somebody, a doctor who is listening and has a plan for them. And I've witnessed that, and I've heard those stories. And I want to see this change. I want to see more doctors who are invested, and I want to see communities invested in women's health, because I think it's so important, because
So
women
important.
they're running this, well, with the
They are.
exception of a few things, but we're not going to get into all the politics now, are we? Dr. Fitzgerald, thank you so much for joining us today. For the listeners, you can learn more about Dr. Fitzgerald on the She Plus Foundation website. If you like what you heard today, please rate and subscribe to our podcast. For more information on the She Plus Foundation, go to www.sheplusfoundation.com. Remember, sex care is self-care, and sexual health matters. Thank you.
Thank you so much for having me.